Ranjan. One of today's topics is going to be the differentiation between ADHD and bipolar disorder in children. And this is a very common question that comes up in clinical practice. These two conditions actually do share several symptoms, such as poor concentration, increased impulsivity, and so forth. However, in bipolar disorder, what you see is that the main symptom is going to be inexplicable mood swings. Sometimes will manifest as rage episodes, which are totally unexpected and inexplicable. And these episodes are typically episodic in nature, meaning the child is not angry every day, so he or she has some days or period of time when he or she is inexplicably angry, and other times the child may be either depressed or just not depressed, nor euphoric, nor irritable. And as I said earlier, the impulsivity is a common symptom among these two conditions. However, the impulsivity seen in bipolar children, again, is most likely going to be more episodic in nature. Now, to complicate issues here, these two conditions often coexist. So it's the job of the psychiatrist to make sure that the diagnosis is made very accurately. Because if the child has both ADHD and bipolar disorder, the best line of treatment is to put the child on a mood stabilizer first before putting the child on any medication for ADHD. Since many of the medications used to treat ADHD, especially stimulants, can actually exacerbate the symptoms of bipolar disorder. So therefore, it's most prudent to control the mood symptoms with a mood stabilizer and then add a medication for ADHD if the child has both conditions. Additionally, I believe children with either condition should also receive counseling. Medications are the mainstay of treatment. However, the counseling is also very critical. The ADHD patients or children with ADHD often have serious self-esteem issues, and they also may have peer-related issues, such as they may have difficulty in learning social skills, and therefore the counseling could be very, very useful. Bipolar children also could benefit from counseling, since good cognitive behavioral counseling possibly could help them in learning how to modulate their episodic mood swings. Of course, the parents should be educated about these conditions as well. One of the books that I often recommend to my patients, actually parents of my patients, children who have ADHD, is called Driven by Distraction. I think that's available at any local bookstore, and most of the libraries also carry that book. The parents of bipolar children should read the book called Bipolar Child. Again, that's a very well-written book. It's very informative, and I believe these two books should be an essential part of overall treatment strategy of children with bipolar disorder and ADHD. If you have any other questions regarding these two conditions, please feel free to post those questions on our blog. Thank you.